Hi, I'm Guy Lucchi, and I'm the Digital Innovation Director for Health Innovation Manchester, and I'm here to share the work we've been doing on the GM Care record. As COVID struck, we pivoted our focus on supporting the response. We did this by reviewing our pipeline of in-flight and proposed projects to identify the ones that would really make the greatest impact. This resulted in us pausing some, accelerating others, and identifying new ones. The key projects are highlighted on the screen, which included establishing a digital coordination group with representatives from across the system, including GPs, acute providers, commissioners, and the council to coordinate the digital response. Improving information sharing and intelligence about the disease was deemed critical, which in turn drove the need to resolve information governance across Greater Manchester and to accelerate the delivery of the GM Care record and the associated population health analytics platform. So what is the GM Care record? The GM Care record pulls together data from GP records, hospitals, community, specialised services and social care into a single record. It includes medical information such as problems, medications, test results, hospital activity data such as A&E attendances and discharges, social care information such as care packages and family contact points. For patients, this means they don't have to keep repeating their medical history. For clinicians, this means easy access to all available information about a patient so they can make the most informed decision to provide the best possible care. Significant progress has been made in GM since March 2020. We have increased the number of patient records from 2.2 million to 3.1 million, and we now have 99% of the GP sharing their data. We've accelerated data feeds from secondary care, specialist services, mental health and social care settings, and data feeds from Northwest Ambulance Services, out of hours and 111 are all in flight. We have removed the locality walls within the record, enabling every clinician to see patients across GM, not just patients from their own locality, and the number of users has doubled since March. The Greater Manchester Care record has been a big transformational enabler, but it's not just about direct care. As part of the GM Care record, there is a cloud-based population and analytics platform, which now contains 6 billion rows of patient data for further research and analysis into COVID-19. Data allows GM to track and understand the impact of COVID-19 and to develop programs of work to counter the pandemic. This is all backed by a GM-wide approach to data protection and information sharing in accordance with national guidance, ensuring patient information is used safely, securely, and legally. So how is this data being used? Well, it's being used for business intelligence, cohort identification, service planning and evaluation, cohort segmentation to support COVID-19 testing, research studies to better understand COVID-19, and COVID cohort identification to support clinical trials. To support the secondary usage process, we have implemented a robust operating model that ensures the appropriate use of the data. This includes the establishment of a secondary usage and oversight group, which includes representatives from patients, data controllers, clinicians, and academics. The right side of the diagram shows the high-level decomposition of the data sources, which comprise the GM Care record and the 6 billion rows of data. The left-hand side of the diagram shows the operating model we have implemented to ensure the appropriate use of that data. The secondary usage and scrutiny group has a particularly important role in challenging the use of data by ensuring secondary use of data is in line with the priorities for the COVID-19 emergency and aligned with clinical need, by ensuring that all activities on the data are aligned to the coping notice and the data privacy impact assessment, by challenging the planned use of the data and a mechanism for escalation, by acting as a point of liaison between key digital clinical groups around data usage, and providing public transparency of data usage. The GM Care record is an invaluable asset in our response to COVID-19 for both direct care and population health management. Frontline staff love it, the system loves it, and patients need it. Thank you very much. Goodbye.